If you're watching this video, you're probably having pain somewhere in this area. Is it my hip? Is it kind of my groin? Is it sometimes back here by the SI joint? You know, which is it? Well, hopefully in this video, I'm going to help you clarify to figure out what's going on and what you can do about it. Hey everyone, welcome to the front row. My name is Ed DeBoo, physical therapist out of Integrated Physical Therapy in Bellingham, Washington. So when I have a client that comes into the clinic and they might be presenting with hip pain, but oftentimes it's a little bit diffuse. It could go up into the back by the SI joint. At times they could give a groin pain. Sometimes it's deep in the hip and they're just not sure what it is and what they need to do to go about treating it. So in this video, I'm going to talk about a simple diagnostic test that you can do at home and give you an idea of what might be causing some of your pain. And then also towards the end of the video, I'll show you a simple thing that I always send people home with to see if they can help improve the overall mechanics of the hip to clear up some of the background noise. All right, let's get started. So the test I'm going to show you is called the F.A.B.E.R, and it's an acronym for Flexion, Abduction, and External Rotation. And if you've been to therapy before, you may have had your therapist do this, but I'll just show you how to do this at home. And it's a pretty slick test. So what you'll do is you're going to lie down. And in this example here, I'm going to be testing my left hip. And what you're going to want to do is put your ankle on the opposite knee, and then you're going to let your leg slowly drop down as far as you can. Now, oftentimes it'll start to get a little bit painful. And where you experience the pain is critical in terms of figuring out what the source is or possible sources for your pain. So as you drop it down, if you start to get a lot of groin pain, then possibly what that could indicate is it's more of what we call an intra-articular hip dysfunction. So it could be a labrum, something deep within the hip joint itself. Could also be tightness or some spasm of the iliopsoas or the iliacus. If you start to get more pain as you let your knee drop posteriorly, like right in this glute area, that could indicate some tightness in the deep hip rotators, and that's the one that I'm going to show you how we're going to kind of release and loosen that up. Or sometimes you'll do this test and you'll get pain right by the sacrum, and that could be indicative of more of a sacroiliitis. If you're not experiencing any pain with it at all, you might want to put a little bit of overpressure or have someone push down on it just to kind of give you an idea of how far you can go down before you start to get some pain, or if someone puts over pressure if you start to experience some pain. You always want to test it to the non-painful side. So in this example, I'm going to pretend that my right side is fine, put my ankle on my knee, and let it drop all the way down. So a normal F.A.B.E.R means you're able to drop that knee almost all the way down and not really experience any pain, just a natural stop when you get to the end. So in this example, if my left hip is the one that's irritated, I'm definitely not going to be able to drop it down as far. So knowing where it hurts is the first level of distinguishing what might be the source of the discomfort. Sorry to interrupt the video, but if you're finding the video helpful, please consider giving it a thumbs up, subscribing, and turn on your notifications so that you never miss another one of my videos, okay? Back to the video. Now my preference in terms of a trigger point tool for working the deep hip rotators is a lacrosse ball. But if you don't have a lacrosse ball, you can get a tennis ball, but I'm telling you, eventually you will need a lacrosse ball to get down deeper. So first what we need to do is meet the deep hip rotators, and so you get an idea of what we're really trying to do.
The first muscle highlighted on the right-hand side is the gluteus maximus, and it's a big, strong, powerful hip extender. And tightness of the glute max can give us all sorts of hip issues and tightness. But what we want to primarily focus on in this video are the rotators that are underneath. So in the next slide, we'll take a look at actually what happens if you cut the glute max away and reveal what's underneath the glute max. In this picture, we've kept the glute max on the left, but on the right, we've reflected or taken off the glute max, and so you can see the deep hip rotators. And what I want you to appreciate here is the number of different muscles that we actually have. And the one that's highlighted is the piriformis muscle, which gets a lot of publicity because of the sciatic nerve oftentimes pierces right through that piriformis. So tightness or trigger points in the piriformis can cause a whole lot of trouble with the hip. The last muscle I wanted to highlight, and you can see it there in orange and yellow, is the quadratus femoris. And it's a small muscle, but yet it oftentimes is very tender. And as you can tell by its orientation, if it's tight, it really can lock that femoral head into the acetabulum, or basically the ball and socket joint of the hip. So as you're doing your lacrosse ball exploration, make sure you want to get all the way into that area to see if that is indeed tender, and the trigger point working there works really well.
Now that you've met the deep hip rotators, we're going to try to work on releasing them or working the trigger points in that area. Once again, in this example, it's my left hip. And I know it's dysfunctional because I can't drop down as far on my left side as I can on my unaffected right side. And remember what the goal is. The goal is to have you be able to drop that knee all the way down and have it just be a comfortable, natural stop without any pain or pulling anywhere. So what you'll do is, instead of putting the ankle on the knee, you're actually going to put your foot on the ground this time, and you're just going to get an idea of how far it can fall out. So it's the same kind of concept, except you're not up here, you're down here. And just get an idea of how far it goes. And then what you're going to do is you're going to put this lacrosse ball, and we're going to scour this whole area, right around this glute area through here with this lacrosse ball. We're going to put it right in there, and then we're going to drop down on it. And what we're doing is we're going to move it around until we find areas that are particularly tender. It might take you a while to kind of scour that whole area. We're just going to check this whole area right through here. And let me tell you, you're going to find some places that are exquisitely tender. Like, I don't have any hip issues right now, but when I get into here, it's pretty tender. Now, when you find a sore spot, there's a couple different ways we're going to work it. You can either pressure on and pressure off, pressure on, pressure off, or you can just hold steady pressure. Now, oftentimes, if you hold steady pressure, it's so sore that you're fighting it. So what I'd rather have you do is pressure on, breathe through it, and then back off again. The idea is no more than 1 minute per sore spot. So after you've worked that for approximately a minute, then you can move along here and try to find the other one. If you find another sore spot, you're like, okay, there's a special one right there. Same thing. This one is not as tender, so I can do a nice steady pressure for about a minute until I feel like that muscle starts to release a little bit. You might find a total of 3 or 4 sore spots in the area. When you're done with that, get an idea of how far your hip can drop down, and more than likely it will drop down a little bit further. So regardless of where you might feel the pain when you initially do the Faber, I always recommend treating the deep hip rotators, because releasing some of these exquisite trigger points in the area will always clear up the picture and almost always will give you a little bit of a drop down so you have a better idea of what's going on into that hip. After you're done working the trigger points, like I said, a minute only, so it might be a total of 5-6 minutes total. Then when you're done, oftentimes I like to give it a stretch. And while you're down here, you can just go into this stretch right here. If you do yoga, you can do a pigeon stretch and release that even further. Hold it steady for a 30-second stretch. You can also try to come across if you like to do it this way here. I have another video on back and hip stretching. I'll link it right up here so you can go to that one if you'd like. And just kind of loosen that up. And then you can go back and test the Faber with the ankle on the knee and let it drop down. And your goal is to have it drop further and further down. Now at the beginning, if you were up to here and it's starting to release and drop down, then you know you're on the right track. So keep doing that once a day until you feel like it's not nearly as tender, or it's about the same level of tenderness as it is on the other side. And that's it. Oh, nice catch. All right, hope you found the video helpful. By now you should have an idea of what the Faber is and how you can do a simple test at home and help determine, based upon where the pain is, what you might be having, and also too how to release some of those deep hip rotators, because those really are the key to this hip. And I always go to that first just in case there's any issues there within the tenderness. And if there is, I want to try to clear that up first, because it really does clear up the background noise a little bit. If you have any questions, please leave them down below, and thank you for watching.